Hey guys, welcome to the Physio channel. This is called the squeeze test, and it's a test for your muscles on your inner groin. They're called your adductor muscles. I'll put a picture of them on the screen here. So this video is about groin pain. The most common cause of groin pain is adductor tendinopathy. The adductor muscles and the tendon at the very top, right up in your groin, can become painful. So I'm going to show you now some tests you can do to determine whether it might be adductor tendinopathy. That is a problem with the muscle and tendon. So the squeeze test, lie down with the legs out and a space between the feet, cross the arms over and then come down from the inner ankles to the lower leg below the knee and ask them to press in. Good, so they're pulling their legs in and you're blocking them with your hands. Go. Ask them to do that for about 3 seconds to see whether they experience any pain up in the groin. You can do slightly different angles by having your hands closer together, so push in, good, and wider, push in. Okay, test a few different angles to see if that makes a difference. You're looking to see if they report the pain that they've been feeling in their groin. The next test is also called the squeeze test, except here we have the knees bent up to about 90 degrees, and this will load up the adductor longus, which is one of those adductor muscles in the group. Place a closed fist between the knees and ask the patient to squeeze the knees together and see if that causes any reproduction of their pain in the groin. You could do 2 fists to change the angle, and if you have, or you're a medical professional or therapy professional, then you may have a biofeedback, very simple thing. Pop that between the knees, squeeze, and that will give you a reading. Get them to squeeze as hard as they can. Make a note of that reading and make a note of how much pain they may have experienced. Do your rehabilitation, monitor them over a number of weeks and retest that when they come back to see you and on subsequent sessions, and that will help you to monitor their recovery. They should get stronger, be able to squeeze harder and feel less pain following some recovery and rehabilitation. The next test is called the sit-up resistance test. As the name suggests, the patient needs to do a sit-up like this, and then the therapist adds some resistance by pushing down on the knees and over the chest and seeing if the patient can hold that position or whether they cannot, and it causes pain in the groin. Here's why. When the patient does a sit-up, it activates their abdominal muscles, their rectus abdominis. Now those muscles are connected to the adductors, specifically that adductor longus muscle. Have a look at the picture showing on the screen here. It shows that there's continuation between the abdominal muscles and that adductor groin muscle. That's why doing a sit-up, especially when you add resistance, can cause some of that groin pain to be reproduced. It may also cause some pain at the very lower attachment of those abdominal muscles, which is a slightly different issue, but the exercises in this video may still help. So that's the end of our resistance tests. Next we have a stretch test. This next test is a simple one. It's the stretch test for the adductors. Stabilize on the opposite side of the pelvis. Take one leg with a firm, secure grip and then bring the leg out into that adduction movement until either stretching or pain is reported in the groin. In the next part of this video, we're going to look at some treatment options. And here our patient is wearing an SIJ support belt. That is some compression around the pelvis, which can help to stabilize things and reduce the symptoms from groin pain. It's definitely worth a try. They're not expensive to purchase, and if they're going to help, they're going to help straight away, so you'll be glad you bought one. Let me show you how to apply a sacroiliac joint belt. Okay, this is how to apply a sacroiliac joint support belt, otherwise known as an SIJ belt. It's a thick belt made of stiff material, Velcro, and 2 elastic pulls at the back. Now using those is really important, so I'll show you how to do them. Firstly, find a couple of points on the body which will help you to put the belt in the right position. So it's the point between those bones on the outside of your hip, the greater trochanter, and the tops of your pelvis. That's where the belt wants to go. It wants to go just below that pelvic ridge and wrap around so it stabilizes the pelvis. It won't work and it won't be very comfortable if it's too low and it's around those outer hip bones. That will affect when you're trying to walk and rub on those bones, be a bit uncomfortable. And it also won't work if it's up and into your tummy and over the top of the pelvis, over the top of that iliac crest. That won't work. That'll just squeeze your tummy and won't really achieve anything. So it needs to go around the bony part of your pelvis. So take the belt, make sure it's the right way around, pull those Velcro pieces off at the back to make sure they're loose and not adding any tension, and then wrap the belt around. Pull it as tight as possible. Remember, in between those lateral hip bones and the pelvic crest there. So pull it nice and tight. Next, the most important thing, undo those Velcro straps at the back, pull them tight. Secondly, keep that tension, bring them around and stick them onto the front of the belt so the Velcro is secure and it's added tension through the belt. It should then feel nice and tight and snug, shouldn't be pressing on your tummy and should be located below the iliac crest, that's the top of the pelvis, and above those greater trochanter. Okay, so that's how to put on an SIJ support belt. Guys, if it's gonna work, you're gonna know pretty quickly when you're moving and walking around whether it helps. For some people, unfortunately, they're not that comfortable and they don't get on with them. But before you give up, make sure you've put it in the right place and put it on with an adequate amount of tension. There we go. Hope it helps. Let's move on. Okay, so the next thing we're going to do is an exercise to help reduce the symptoms from the groin pain, hopefully to reduce that sensitivity of that adductor tendon, ultimately reduce the pain. So what we're going to do is some adductor squeezes. We're going to get those muscles to work, we're going to get them to contract, we're going to get them to do that in a way that they don't actually move, so it's a static or an isometric contraction, and the patient can also modulate how much effort they put into it. So if it hurts when they try the exercise, they can simply try it with less effort, perhaps a 50% muscle contraction rather than trying to squeeze as hard as they can. So what you need is something for them to squeeze between their knees. They lie in the back like this with their knees up in that testing position that we had earlier. I'm going to take something that they can squeeze. Here I've got a soft foam ball. Place that between the knees and ask them to squeeze that. Let's start with a 25% effort, so 25% of what you think you could do, and keep that 25% and keep squeezing. Okay, around about 60 seconds. You can do a little bit less, but once you've got to 60 seconds, that's enough. Stop, have a rest, and then repeat the exercise after that. So we're on 25% at the moment. Is that causing any symptoms? No, okay, we'll go to 50% then. Squeeze, 50% effort, try and sustain that. Okay, and we're going to stick with 50% now for up to a minute. And then after a minute, we'll stop, take that away, let the patient have a rest for a couple of minutes, and then repeat that. If it's going to work, you may notice that there's some reduction in pain and sensitivity from the groin even after the first effort. But certainly after 2 or 3 goes, so that's 1 minute times 3 with 2 minutes rest in between, you should notice some reduction in the symptoms. Not only does it reduce the sensitivity and the pain from the tendon quite quickly, but it's also starting a strengthening program, which is part of the longer term rehabilitation plan. So we'll go ahead and repeat that again for 60 seconds with a 50% muscle effort contraction. If they get on well with a 50% effort, then by all means increase the amount of effort they're putting into it, increase the intensity up to say 60, 70%. It's hard to squeeze with 100% effort because remember they have to sustain it for 60 seconds. And it's very hard to squeeze with a maximal squeeze, and to maintain that for 60 seconds would probably be a bit too much to ask. But perhaps 75% might be more reasonable. Anyway, after a minute, take that away. If you haven't got a soft ball to squeeze, you could use a rolled up towel, for example, that'll work, and you can have obviously different widths of towel. And also, usually you've got foam rollers around your clinic. They can also be ideal to squeeze between the knees as well. You do want to experiment with different angles, so having some wider things to squeeze and also having the legs up at different angles will just slightly change the way the adductors are being recruited and may help to get more out of the exercise. There may in fact be an angle which is most preferred by the patient. So do try different widths and different hip angles for the exercise. So we could do the hips up here, held in that position with a squeeze with the hips up at 90 degrees. So that's the first exercise routine, the adductor squeezes. So the next exercise is a bit more dynamic. We've got a resistance band around the knee, and then the patient needs to stabilize the other leg in their pelvis whilst they let this leg drop out under control and then back in again, pulling against the resistance band. Good. And repeat. The movement should be slow and controlled, especially the other leg and the pelvis should remain stable. Doing the movement slowly and under control increases the amount of time that the muscle and tendon are held under tension, and also makes sure the patient gets the most out of the exercise and is focused more on the quality of the movement rather than how many repetitions they are going to do. But in terms of repetitions, they're going to aim for somewhere between 6 and 10 repetitions. If that feels quite easy for them to achieve, then the natural thing to do will be to increase the resistance. And if you have a resistance band or they're using one at home, the easiest way to increase the resistance is to either hold the point closer so there's less band, which means it might tighten up a bit quicker, or to double up the band, which will double the resistance straight away. So just make sure it's not too hard too soon, but then they can repeat the exercise with more resistance. Here's an example of an advanced exercise for your adductor muscles. Now it is quite advanced, so if you're experiencing some pain and discomfort, you probably won't be able to or want to do this one, but it's perhaps something you could aim and work towards, especially if you're looking to really get some good strength into those adductor muscles. So the long lever adductor bridge is a pretty hard exercise to do, but it definitely targets those adductor muscles in addition to lots of your core stability muscles as well. You can make this exercise much easier by shortening the lever as shown in the example here. Okay, I hope those exercises helped. If they did, hit the like button and leave us a comment below. Do stop the exercises if the pain gets worse, but monitor the next day response rather than the immediate response to the exercises. What do I mean by the next day response? Well, when you do the exercises, hopefully it will make the tendons feel a bit less sore and hopefully reduce your groin pain as a result. But it's often the next day that you get a true response and reflection on how well your body responded to the rehabilitation and exercises the previous day. It's what we call like a delayed response. So monitor how you are the next day and think about what you did the day before in terms of exercise activity and rehabilitation. If you're okay and there's no particular changes, then that's okay, carry on. If it's aggravated the situation and feels a bit worse, then perhaps have a look at the rehab you've done and do less of it, perhaps push with less intensity or do less volume of the rehabilitation. Of course, this is just an educational video, so make sure you get a medical assessment at the beginning and don't hesitate to get a medical assessment if things aren't going as planned. If things are going as planned and you're finding the exercises help, then once a week, see if you can increase the intensity of the exercises, only a little bit though, by about 5%. So push harder with the isometric contractions by 5% per week, or increase the duration with which you do them, or of course advance to some of the more difficult exercises that are available, one of which I showed you on the video. So make sure you get a medical assessment and some help throughout. If you're looking for some more details on adductor tendinopathy, then have a look at this more in-depth video showing on the screen here. Thanks for watching. See you in the next video.